Ladies and gentlemen, if you'll please take your seats. Dr. Jennifer Young Pierce is a distinguished senior staff physician and professor of gynecologic oncology in the University of South Alabama Mitchell Center Institute, MCI. Since joining USA Health MCI in 2017, Dr. Pierce has brought national expertise in human papillomavirus, HPV, cervical cancer, and cancer disparities to her role. Currently serving as the Division Director of Cancer Prevention and Control, she also holds the title of Abraham A. Mitchell Clinical Cancer Research Scholar. Please join us in welcoming Dr. Young to the stage.
Thank you, everybody. So Linda and I are going to talk about stigma and educating others. And forgive me for telling you a couple of things about HPV that you already know, but I'm just trying to give you a couple of punchlines or taglines that will help you when you're talking to somebody else. Everybody knows this. The original Someone You Love, the HPV epidemic. And I always start my talks with this to just remind people that there can be no stigma when everyone has the disease, right? That, I mean, let's be honest, when COVID started, and you know, the one neighbor who got COVID, and you're like, I know how she got that. I saw on her Facebook page, she was out last weekend. She went traveling. And there is that stigma. But then we all got it, right? Like eventually everybody gets it. And that's the thing with HPV. Everybody gets it. It is more common than the common cold. And, nobody asks a man how he got his HPV related cancer and exactly how many cunnilingus partners did he have. And I do have to apologize to my mom for saying that while she's in the room. But nobody asked that question, right? It does not matter. So I never, and you should never be asked to divulge your sexual history when talking about HPV. It does not matter. And please tell the person who's asking you that it does not matter. So, more common than the common cold. Next point. Everybody has high risk HPV, not just any HPV. So we know 1 in 4 men and 1 in 5 women are currently carrying a cancer causing HPV. So in terms of who gets cancer, it is a little bit luck of the draw. There are maybe some things that we can learn about immune system and our immune response to HPV, and there are cofactors associated with a lower immune system, for example, diabetes, immunosuppressive medications, and smoking. We know those things to be true. Chronic infections or chronic inflammation of the cervix, those types of things. But you didn't cause your HPV cancer. Everybody has high risk HPV. And yes, HPV is necessary for the cause of cancer, but it is not sufficient. There is something about a person's immune response to the HPV that is ultimately at fault. And it's not your fault, right? It's not what you did or did not do. And here is a moment of shame and stigma for me. Y'all know I do this every day, right? And I went 6 years without a pap while doing this every day. I went from 2016, got my IUD changed 3 months before my 3 years was up, was like, oh yeah, I'll be back. Then it was 2020, and then it was 2021, and then there I was. And had a big work shakeup and a promotion and things in 21. So I got back in 22, and my doctor was like, it's been 6 years since you were here for a pap. I was like, how is that possible? I am literally, ashamed to admit that to a group of people who know I should know better. And why didn't I get cancer? Well, probably I got really lucky. And I happened to have been vaccinated 18 years prior to that when the vaccine first came out. And possibly because I'm white. And we know, both privileges and lack of, societal racism and the stigma that goes with that and the stress that it causes and how it lowers our immune system that play into why people get cancer who have no risk factors. And I also don't have cancer in my family. And I recognize every day that I got really, really lucky. But that is a moment to just say to all of you, it's not your fault you went 6 years or however many years without a screening. It happens to all of us because life is busy. And I appreciate everybody's comment that if you tell women 5 years and it might be 6 or it might be 8, and that is a concern. And I too validate that concern. And what we know to be true, and Dr. Eckert knows this as well, is that 3 years with co-testing is better than 5, and that we really shouldn't be spacing to 5 until we have a fully vaccinated population. And so that's what we're hoping to do. That's what I encourage all of you to preach. Next up, in the US, 46,000 cancers. I want you to know I had to edit this slide yesterday because it used to say 39,000. And most of those are head and neck cancers that are ramping up these numbers, not cervical cancers. But it is one cancer every 20 minutes. And there's a lot more out there than just cervical cancer. We know that cervical cancer is the tip of the iceberg. And I wanted to put this in here because my comment is to Tamika. We said we just don't have as many survivors as other cancers. You know what? We do. We really do. The cervical previvors. Has anybody heard that term yet? So the previvors, the BRCA patients who are getting breast and ovarian surgeries to prevent their cancers and ultimately have survivorship issues because of those surgeries and their diagnoses. But also we have 200,000 previvors a year. And I'm going to just a little plug. I had to edit that number as well. It used to be 330,000 a year. So we're going to find these little moments of hope, and I circled them in green. So first, this is our 196,000 cases of pre-invasive cervical cancer a year, but look at 18 and 19 and 20 to 24. Do you see how it's shrunk dramatically since the widespread use of the vaccine? Okay, so yes, we know in our older populations hasn't changed that much because they're not well vaccinated, but we are making a difference. But we want to encourage our pre-Vivor sisters to get out there and share their stories. And this is our prevalence of breast cancer versus cervical cancer. So if y'all have heard of DCIS, right? Everybody knows DCIS? That is ductal carcinoma in situ. Cancer in situ. Recognize it? CIS, same as CIN, same as AIS, all pre-cancers. DCIS is a pre-cancer, but those patients are told that they are cancer survivors. And they are registered in the tumor registry. They get counted at a tumor board. They get told that they're a cancer survivor, and it goes to the state, and that data is collected. And we do not do that at all for cervix pre-cancer. Right. That's why we don't know what the number is. And we need to know, and we need those numbers to be counted, and we need to tell those patients that they are cancer survivors who had a stage 0 cancer, that but for the grace of God and their leap or their cone, that they too would be cervical cancer survivors. And I just want to point out to you here, so, not sure it has a laser. So the breast cancer, the pre-invasive is a light blue, the dark blue is invasive. So in breast cancer, there are much more invasive cancers than pre-cancers. In cervical cancer, I mean, let's get a little street cred, right? It's all pre-invasive and very few cancers. So a shout out to our OBGYN colleagues who are curing all that cancer out there. But here's the hope message. This is survivors. This goes to the ceiling, 4 million cervical or breast cancer survivors in the United States every year. This is the number that I was given when I Googled how many cervical cancer survivors living with cervical cancer in the US every year, just under 300,000. But if you take the previvors, it's 5.5 million. That's how many people are silently living with a history of CIN, CIS, or AIS that they're not telling anyone. And I also just want to point out that I had to lower these numbers. Okay, so that's a moment of hope here that I had to lower these numbers. And I used to say there's more cervical cancer in the country than breast cancer, but there's not as much anymore. And lastly, we know that there's more oropharynx cancer in men than there is cervical cancer in women. And we need to join with our brothers in HPV cancer and make them vocal advocates, because they too aren't telling anyone that their cancer was HPV related and aren't talking about how they acquired HPV. And we really need to have them join this fight. Okay, last but not least, this big bubble over here is the cases of vaccine preventable illnesses in the United States before widespread use of childhood vaccines, and the now, and this is old now, it's 2010, so forgive me, but here we go. This is deaths from cervical cancer before the pap smear in the United States. So when people say the HPV vaccine is not as important as other childhood vaccines, they're wrong. This is cervical cancer and pre-invasive disease prior to widespread use of the pap test. So it is just as important as every other vaccine. Now, this is cervical cancer and pre-invasive disease since the pap smear. We haven't prevented it. We are just diagnosing it earlier. And this is cervical cancer and pre-cancer after the vaccine. We are seeing lower rates. It's going down. That bubble's getting smaller, but we're not quite there yet. So the last thing, and this is the study that Dr. Trunk brought today, and I wanted to show that when he said mortality is on the rise among low-income women, it's not all women. We have known since the vaccine came out that there was a reverse disparity, that African-American women were accepting the vaccine for their girls at much higher rates than white women. And we have now seen the benefits of that mortality continues to decline in Black women, but is on the rise in low-income white and Hispanic women. So we don't want anybody to die unnecessarily from this disease, but we do need to recognize that inroads are being made and that the vaccine is probably responsible for this difference in mortality rates that is continuing to change. So when we talk about reducing the stigma, we want to break the silence with the facts that we've shared, gather our pre-Vivor sisters and advocate for them, and promote that true healing. We talk so much about shame and stigma and how that affects you as cancer survivors. And I really think there's a lot of our pre-Vivor ladies out there who suffer the same and who suffer from not having anybody to talk to and not having a community. And I think would welcome a community and provide those opportunities for the supportive silver lining to turn that diagnosis into advocacy. And I am going to turn it over to Miss Linda here. These are just some of the ways that we're educating people using survivors to share their stories. The one that we're working on together is the Alabama Hope Project to train survivors to work with the Alabama Department of Breast and Cervical Program to get the pre-screenings and really pair those together. But I will turn it over to you, Linda.
Good afternoon. Well, at first, I really didn't know how to introduce myself through my story. I really didn't know what to call me. But praying about it, I will introduce myself as an advocate, a survivor, and I am Linda Hayes. And 2004, I got some news that I didn't understand, but it was devastating. I wasn't educated on cervical cancer. It wasn't explained to me. And I said, yes, something to be done to my body permanent that I can reverse. So after 20 years, I finally could be a voice for some ladies. I can finally let ladies know to do not say yes to anything that's regarding your body if you don't know what's going to happen and what's the outcome going to be. It's our body, and we have a right to make a choice. You have a right to ask your doctor anything about your body. And if they don't want to answer those questions, my advice is get another doctor. But through my story has landed me in a position with Alabama Department of not transportation. I left there public health, and I am the outreach coordinator for the breast and cervical cancer early detection program. So I'm just going to brief you all on some things that we are doing in Alabama to help eliminate cervical cancer, because it can be eliminated, but it takes all of us plus more. The first thing we're going to talk about is the facilities. You know, our facilities, the presentation in some of these rural areas need to be changed. If we want people to go there to get health service, we need to make it look like a health facility. I have been to several places that I did not know that they was considered a health facility about just how the outside looked, regardless of how you went in the inside. I was able to take a tour of one of them in one of our black belt regions, and it hurt my heart to see that. You know, we want to talk about trust, and we want these individuals to come get free service, but who would want to go in a facility that look like it's been abandoned for years? So that's one thing that I will always have a voice on as long as I live is if we want to promote this program, we also need to talk to the individual about how the facility looks. And then the next thing I want to talk about is paying these CHARs, community health advisors. These ladies use their time to get out. I have several that working and doing things for me now while I'm here to make sure my Monday event will be successful. They do it for free. They volunteer. They're not asking for money. I'm asking for it for them because I need them. I need them. They know their community. I don't. And they have a precious heart. So I am just out here to say we need to do things to fund to help these ladies as well. I'm also working with leaders in faith-based organizations because if you're a pastor, if you're a minister, you should know your community. Let's not make our health to be a prayer list. Let's make it be a testimony that we can sit here and say that I got my screening, I done my follow-ups. Even though the news might have not been good news, I still went to my follow-ups. You know, we need to quit waiting to get to the point that we are being prayed about. We need to educate ourselves. We need to read. There's resources out there. You can Google. You got social media. You got support groups. There are places out there that we could get more information that we won't be dying of something that's preventable. Because one life lost with cervical cancer is one life too many. It's unexcusable. I'm sorry, it's unexcusable, but it takes all of us to make this happen. And then the next thing is providers. It's a lack of providers, a lack of people that we're trying to find these physicians who want to be part of the program that will render this free service. You know, we go to these rural areas, might be one nurse. You know, we going out there doing this thing, trying to get help, and we don't have enough. So if you all know people that's in the medical part that would like to be part of a program, it's a nationwide program. If you all not familiar with it, it's a nationwide program that provides this free service. So I'm here just to try to help you all because I didn't have it, but through the grace of God, and I would say that again, through the grace of God, for my experience and me just going through my follow-up saved my life. So I'm here just to say thank you all for welcoming me. Thank you all for just allowing me to tell my story because follow-up saves lives. Whether we know it or not, it saves lives because it saves minds. And Jennifer, thank you so much for just being up here with me. She's from Alabama as well to make it be a comfortable presentation. And Tamika, thank you so much for just inviting me. And all of you ladies, you all rock. You rock. And so just thank you all. Just thank you all. And I'll just leave you all with this because I'm very spiritual. When I go through this, because every time I say it, it's like an open wound because it takes me back 20 years. But as I read the book of Psalms, I ran across a prescription said, God draw close to the brokenness. And that is what keeps me going all of the time. So when I feel like I'm by myself and when I feel like I'm embarrassed of what I went through, or when I feel like I don't have all the questions that I need to know, I just do know that God is so close to me. He's close. And all of you ladies are going through things and you might feel like you don't have that support group. By the grace of God, He's with all of us. Every last one of us, He is with us. So we're here today to just help somebody. Tell our story. Go to your community and say, hey, I am a survivor. It's nothing to be embarrassed about, but we all working together can eliminate cervical cancer. And thank you all so much.
If I could invite Tamika up on the stage, please.
Question? Yes. Okay. Sorry, coming. Question? Yes.
On the vaccination, what age is the cutoff? Like, I'm too old to have been given the HPV vaccine, but is there like a limit? Like when you turn 25, you're not going to have any, like, where's the cutoff on age?
So the original trials were done to 26. The FDA says that you can choose to vaccinate up to 45. And what I tell men and women is that there's a lot of things we do off label outside of FDA approval. So if you believe that you are at risk for HPV and if you are having sex, you are at risk. And so I tell people to, if they choose to get vaccinated, they just need to find a provider who's willing to approve it. And unfortunately, for those outside the age group, they usually will have to pay for it themselves.
Thank you. Next question.
But we start vaccinating at age 9. We want everybody to have 2 shots by 13 is the goal. Of course. Yep. Boys and girls. And we vaccinate boys to protect them from their own HPV cancers, not necessarily to protect women from cervical cancer. Yep. Lori.
Hi. Hi, my
Hi.
name is Claudia Perez Favela. I just want to make a comment when you mentioned about the Survivor. I was diagnosed in 2018 with precancerous cells on my cervix. I have a radical hysterectomy with ovaries removed, and I agree with what you say. The doctors don't tell us if we got cancer or no, if we are patients or no, because I didn't get radiation, I didn't get chemo, and I say that sometimes I have like the imposter syndrome. I don't know if I belong to the group or not, but I really learned that. Tamika helped me to learn that. And it is one of the reasons I'm trying to learn more about HPV, about more cervical cancer, because I want to stop the stigma and try to reach to young people because I still going to school. But it's just the comment I want to make. I agree with you when you mentioned about the Survivor.
Thank you so much for joining the fight. Linda, did you have any comments about having our previvors in the fight?
No, not at this moment. Just
Okay.
continue to fight.
You're not an imposter. I think all of those women are looking for a group to belong to. They all think that they're by themselves. And it's 1 in 6 women have had one of those procedures. So in any room, when you look around, you think, I'm the only one here who had cervical cancer. Do not think that. Look in every room that you're in. 1 in 6 women had a procedure for cervix precancer.
So we have a question online. While the current guidelines for screening are 3 to 5 years, do you recommend those with cervix yearly gyne visits?
Sorry, say that one more time.
While the current guidelines on screenings are 3 to 5 years, do you recommend those with cervix yearly gyne visits?
Oh, I do still recommend a yearly gyne visit. I think it's a great time to check in on your health.
your birth control, your blood pressure, especially if you don't have another primary care doctor. They do a lot of primary care work. And there are guidelines in terms of our primary care that a lot of women seek from an OBGYN. I think a pelvic exam is valuable for screening for other diseases. And I recognize that for a lot of reasons, including past trauma and gender identity differences, that women don't necessarily want to go for those exams. And I do think there are good alternatives in primary care. And we want HPV self-sampling to reach those women who really don't want to seek care with a gynecologist. But for those folks who are open to it, I think it's an excellent part of general well-being. And, you know, for my ladies who come in at 80 and tell me that they still need a pap smear, I say, well, ma'am, it is, you know, a screening for folks that are, you know, at risk. So if you are at risk, then we could screen for other things, but it is every GYN visit doesn't have to be a PAP, and every PAP should always also be an HPV test.
Thank you.
Yeah.
Question?
Oh, great. Thank you, Jocelyn. Great. Hi, excellent. Linda, I have one comment on what you just said. I just want to repeat it for the room because it went right through me. And then I also have a question. So I think you just said health is not a prayer, it's a testimony. And that is the solidness in knowing that this is something that doesn't have to happen. And that we can change that. And I think that is an incredibly beautiful lens through which to see this. There's so much strength in that. So thank you so much. You changed me with those words. Yeah. I want to double click on this Previvors question. And I want to find out what is the legislation or policy that prevents these 5.5 million cases from not being documented, because when you go on the CDC website and you look up cervical cancer, it says that it is a rare disease. And then when you tell women in your community that you've been diagnosed, everyone whispers, me too. I had an abnormal PAP. I don't know what that means. I had a leap. I don't know what that means. I had a procedure. I had an intervention, and no one talks about it. So what is the delta from a policy standpoint to take us from 14,000 to the real number of 5.5 million and get some real attention and power to this? Thank you.
Thank you for asking that. So New Mexico is currently the only state with a PAP registry where any high grade PAP is recorded. And I do think it's going to take funding and advocacy to change that. All tumor registries come out of the pathology department. So it doesn't require doctors to do it. It does not require patients to volunteer their data. It is a mandate to the pathologist to report this dangerous thing to the state to be counted. And they do that for all kinds of diseases. Every cancer, as I said, is documented. In addition to lots of infectious diseases. We all know this because of the COVID registries, that all of those cases are counted. And so there is a way to do it, but it does cost money. Correct. Right. To recognize, just like anything, that like, in order to know the size of the problem, you have to count the cases. And I think the real bend point is that we do it for breast cancer because we want to count how much money we need for the breast cancer program. Why aren't we doing it for cervical cancer? Yep.
So we have one last question over here.
Hi, like Eve, I'm blown away by this statistic of these 5.5 million. And my name's Julie Grube. And seeing that the breast cancer community counts the previvors, it's just maddening. I'm fuming here right now. And so I'm wondering, when we are finding that, we are out here, we are open as cervical cancer survivors, and we have the folks who at our workplaces and our friend groups that whisper to us that they've been, they've had the leaps or the other procedures, abnormal PAPs. How much do you encourage us to kind of inform them and embrace them and saying, should think about yourself as a cervical cancer survivor? Like, how much should we be putting that label on them to help change at least, while we can't necessarily change policies overnight, we can change small opinions and mindsets.
Yeah.
So is it troubling to introduce that kind of language to someone who is in Previvor, or what's your recommendation for how to kind of have people identify in that way?
Yeah, I will say that I do that in my clinic. Every single one that I'm like, great news. This was, after reviewing your cone on pathology, it's non-invasive. That does still mean you're a cervical cancer survivor, stage 0. But I think the big point of knowledge that helps bring them into this fight is every single one of them needs an HPV vaccine. There is new data now from a meta-analysis and it's specifically for pre-invasive disease. I do offer it to my invasive cancer patients because that study has not been done. But for pre-invasive disease, there's a 60% reduction in recurrence for people who were vaccinated after treatment. And I think if we vaccinate all 5.5 million of those women, it really gets down the stigma on vaccination. And then, they're more likely to vaccinate their children and to tell their sister or their aunt or their cousin. And that is that trickle down to get over that stigma of like, oh, being vaccinated says something about me. It doesn't. It says that you choose health over testimony.
Thank you so much. If I could now invite Tamika to the stage, please.
Huh? No. So that was a great session. I'm so happy to finally meet Linda in person. I can't wait to get her to Survivor School and a few other things. I wanted to take a moment to talk about Dr. JYP, as I affectionately call her. We've known each other for a long time. I always laugh and say, so long. We both weren't married. We didn't have children, all this other stuff when we started. I've grown as an advocate because of her. She has taught me a lot. I love when she always shares about the previvors, and we do need to use that data even more. She has been just such a wonderful partner, but also a sister. She has taken care of me in ways of making sure that I'm good. The organization is knowledgeable about stuff. She'll see a mole in my foot and say, you need to get that looked at. But just being great on all accords. She gives of herself not only for this organization, but many organizations, whether it's in our home state of South Carolina, her new home in Alabama, or just wherever she's called. You have a busy, busy, busy life, but you always make time for me and this organization. And again, you don't need hardware, but we just have a very small token of appreciation. As we're nearing these 20 years, it is very important to me. I don't know how many of you grew up with a saying, you give people their flowers while they're still here. You heard Nancy Brinker talk about Edith Mitchell yesterday, and I was gutted hearing at her loss. Morgan and I were trying to decide if we were going to put a slide in and honor her here or honor her later. And again, if you don't know who Dr. Edith Mitchell is, you should certainly search for her and learn more about who she was and how she touched upon cervical cancer and health inequities. But I want to thank you for just being a wonderful partner in purpose and a gladiator for good.
Thank you.
Thank you. Your award. Let's pick
Okay.
I know when,
Yep. Okay.
but you take one first.
Oh, by myself?
Give me.
Okay.
And while we're transitioning, I think we have a short break next. Oh, we're not going to take a break. Did I give approval on not taking a break? Did they ask for my, no, I'm just joking. I'm listening to them. Yeah, we're going to do ours.
Okay.
You want to, yeah.
Yeah.
Because they're ready to go, child.
Okay.